This patient was referred to me for endodontic treatment of tooth number 2. Patient says his dentist put a temporary filling in there a couple of months ago, and over time he just lost bits and pieces of the temporary filling, and now there is nothing there. So patient said that he spoke with his dentist. His dentist told him that the tooth is definitely salvageable. The dentist told him to come see us for the root canal, and then he would go back to his dentist, and the dentist would build it up and crown it. As you can see, that's decay right there. That's the pulp, of course, and you can see the periapical relucencies there. This was a subgingival mesial decay, so I let the patient know you will need crown lengthening, and that's something that your dentist, either your dentist will take care of or a periodontist before the tooth is built up and crowned. And patient said that he agreed, but he definitely wanted to try to save the tooth, and that's what we did today. Went in, cleaned out that decay there, subgingival decay, rebuilt that mesial wall with composite, and take a look here. And here's the post-op. You can see how large that periapical relucency is. As you can see, everything went beautifully. Let me show you. That's another angulation of the tooth. Again, you can see that we rebuilt that mesial wall. Everything went great. As always, I trough for an MB2. Wasn't there. That's another angulation. Another angulation. There's one angulation where you can see a nice, there you go. Look at that beautiful lateral right there. All right, so everything went great. We did this again in one appointment. Tooth number 2, upper right, second molar. Took us about 40 minutes or so. Temporize the tooth and refer the patient back to his dentist. The dentist will, either the dentist or a periodontist will do crown lengthening there, because as I said, decay was subgingival. Crown lengthening, build up, and a crown.